For more on the pandemic, let's bring in NBC News medical contributor, Dr. Uche Blackstock. Dr. Blackstock, let's just kind of jump right into this Delta variant. I've spoken to health officials in Missouri on and off last week, and again in that state, they kept telling me that they are seeing an increase in hospitalizations and that the COVID patients hospitalized are way younger than before, 20 to 60 years old and often unvaccinated. Those are people who could get vaccinated if they wanted to. So what about this new variant and children under the age of 12 who are not able to get a vaccine, even if they or their parents wanted them to?
Right. Good morning. Thank you so much for having me. You know, we don't have any signs yet that this Delta variant is more transmissible or more severe in kids than in adults. But obviously, it still is a risk. And so until children under 12 can be fully vaccinated, we need to ensure that the adults around them, as many as possible, are vaccinated, and then ensure that when children are in high-risk environments, such as crowded settings and indoors, that we are still abiding by preventive measures, especially in communities where the transmission is high and vaccination rates are quite low. We really have to make sure over the next few months that we're focusing on protecting our children.
In India, doctors there are reporting a new variation of the Delta variant, and they're calling it Delta Plus. They say that it is more transmissible than the original Delta variant. What do we know about that variant at this point in time?
Right. So we still don't know enough about the variant. We know that in order for it to be considered a variant of concern, it's supposed to be more transmissible or cause more severe disease or evade coronavirus antibodies. So it has one of those attributes. But again, those were just shown in lab studies. We need to see how does this variant, Delta Plus variant, behave in real life settings. We already know that it's present in about 8 other countries. But again, you know, I think just like the Delta variant, we know that preventive measures work. We know that vaccination works. And also genomic surveillance is incredibly important to keeping track of these particular variants.
Daily vaccinations, those numbers seem like they are just dropping every day right now. Do you think that people might reconsider getting vaccinated given what we're seeing with the Delta variant? And I guess, are there any convincible unvaccinated people left?
Right. Yes. You know, I definitely think there are some left, and we've seen this in some of the polling. There still are these wait and see folks out there who are waiting for full approval of the vaccines that will actually cause a shift in making them decide to get the vaccine. But there's also a tremendous amount of misinformation out there, and I think that is one area that the Biden administration is targeting, as well as continuing the incentives, continuing the outreach, especially among young adults 18 to 26.
All right, well, if anybody is looking for a good source to dispel misinformation, your Twitter account is one of my go-tos, Dr. Blackstock. It is always so informative. Thank you so much for your time this morning. We'll see you again soon.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.